Let's check the COVID situation in the provinces near Metro Manila. We now talk to Dr. Corazon Flores, Regional Director of DOH in Central Luzon. Good morning, Dr. Flores. Thank you for joining us.
Magandang umaga, Ms. Ria. Magandang umaga po sa CNN viewers ng UT.
Ma'am, more than a week ago, the Octa Research Group said 3 provinces in Central Luzon were among the areas with the highest number of new cases. But Professor Guido David also said yesterday that the general trend region-wide is that the cases are going down. So ma'am, could you tell us please, what is the situation on the ground at ano ho yung mga provinces na apektado ng pagtaas ng kaso?
Okay, so as of October 11, our total active cases is now down to 10,280. And before it has gone up as high as 20,000. That's there's already a big reduction in the number of active cases. In terms of new cases reported, we have new cases is about 778. That's really a very big dip in terms of the trend in the number of new cases reported per day. So overall, of course, we have 2 provinces, declared as MECQ. That's Bataan and Bulacan. But really, their cases have really gone down. And of course, our overall regional epidemic risk is at low risk.
All right. Now, one thing to consider in the pandemic, of course, is the hospital utilization rate. How are the local hospitals coping in these areas, and how are they in terms of supply of medical equipment?
In terms of the regional healthcare utilization rate, our regional HCUR is now down at 56%. With our COVID bed utilization at 56%, we have mechanical bed with a low utilization rate also, and same with the quarantine facilities at 28%. There was, there was an increased need for oxygen supply. Of course, what we did is we coordinated with the different suppliers, so that's why we're able to mobilize and connect them with the different hospitals so that oxygen supply will be delivered and provided to the different hospitals.
Okay, ma'am, kamusta naman ang mga healthcare workers sa area nyo? Do you have enough healthcare workers in the region, and how is their morale?
So I would like to thank every health workers that we have. They have really contributed a lot. And so sabihin natin po, pagod na rin, burnout. But really the compassion, the commitment to do their part to ensure that we take good care of all our patients is there. And the number of quarantine, the health workers now is, of course, as of October, is now down at 1,100. It usually, last month, it went up as high as 1,600. So that's really an improvement. And the good thing is our healthcare workers are vaccinated. That's why if they got the COVID, they can easily recover and they only have mild symptoms. But really, they were really burned out with all this thing that is that we have been doing since last year.
Yeah, I can only imagine. Ma'am, you mentioned vaccination. How is the vaccination rate in Central Luzon? Do you know the percentage of the population that is already fully vaccinated?
So our target population for vaccination is around 8.7 million. Now we have already vaccinated with first dose is around 35%. That's more than 3 million. And fully vaccinated is 26%. So now that the NBOC is providing us with priority in the provision of vaccine, we are expecting that we can achieve more by the end of the month.
All right. Thank you, ma'am, for your time this morning. Do stay safe, stay healthy. That was DOH Central Luzon Regional Director Corazon Flores.